I'm Mike Royer with an extended interview in this Health Matters Web Extra. It's time for another Health Matters segment, and we welcome to the camera and to our segment Dr. Louanne Friend from the University School of Community Health Sciences. Now correct me.
College of Community Health Science.
Very good.
Very close.
I should have had your business card in front of me before I tried to tackle that. Thanks for coming back on the program today. It's good to see you.
Nice to see you. Happy to be here.
We're going to talk about a topic and then something new that will help people who deal with hypertension, high blood pressure. First of all, what is it? Who gets it? Who's most likely to deal with it?
With hypertension, unfortunately, that's cardiovascular disease is the leading cause of death in the state of Alabama, and one of the leading causes of death throughout the country. So approximately 40% of our population has hypertension that they're aware of. We also have a large percentage of the population who have high blood pressure who are not diagnosed. So it's really hard to capture that specific number, but most of the people who have hypertension are not well controlled. And by that we mean the top number, that systolic number, is less than 140. And the diastolic or lower number is less than 90. So those are the targets that the American Heart Association and different organizations really want us to strive to meet. But unfortunately, we're just not doing a great job with that yet.
You threw out several numbers there, and the one that really caught my attention was 40% of Alabamians deal with some form of hypertension.
Yes, sir.
Is there anything else that 40% of our people deal with? That seems like a very high number.
Well, it is a high number, and unfortunately, our state doesn't have the healthiest metrics for many reasons. Lack of access to care is one of them. So it is a high number, and we're working very hard at University Medical Center to get our patient population in that control zone. As you know, hypertension doesn't have any symptoms. So it's very hard for people to get the diagnosis and then make many of the lifestyle changes that are needed to control hypertension.
Generally speaking, should someone who struggles with weight, as a young person, as a middle-aged person, as an older person, be alert to this and suspicious that carrying too much weight could be a contributing factor?
Yes, that's absolutely right. That is one of the risk factors, and we are very concerned with COVID that many people have kind of put their primary care on the back burner. People are afraid to go to the physician. I understand that. People are afraid to go to emergency rooms. We're having reports of fewer people showing up with heart attack and stroke to our emergency rooms, waiting too long to get essential care. And I think a lot of that is out of fear, which I understand. But yes, we encourage everyone, 18 and above, to have that screening every year, because we're seeing, unfortunately, more hypertension in our pediatric population also.
For someone that sees this, that thinks, I wonder if I should get checked for this, I have too much weight, or maybe I'm short of breath, I don't feel great, I wonder if I have hypertension. If they discover they do, is most of the prognosis, not the prognosis, but the advice that a physician would give a patient, lifestyle changes or some medications or both?
Well, if we catch it early enough, what they will initially advise is lifestyle modification. And by that I mean all of the things that we know we should do: decrease our salt intake, which is difficult because there's a lot of hidden salt in food, increase our activity, quit smoking, very, very important, and moderate how much alcohol we drink. If medications are started, the lifestyle modifications are still very important. One pill is not the cure, it's not a magic bullet, and I think that's what's very hard about controlling this. It is a chronic disease, and it takes a team effort, and most of the things that can be done to help are really controlled by the patient.
And unfortunately, that might mean giving up some things you like. Irregardless of smoking or alcohol, the foods we like, we love sweet tea, we love barbecue, white bread, any kind of bread.
Absolutely.
I guess all of those things are things that you don't probably advise people to give up entirely, but just cut back, make an effort to improve those areas in your life.
Yes, sir, and modify how you prepare your food. You know, I grew up in the South, and we fried everything,
Sure.
you know, and I love it. I still do. But all things in moderation, and we have a fabulous clinical nutritionist, Suzanne Henson, who I know has done many segments.
Yes.
And she's got great ideas for how to adapt your recipes so that they're more heart healthy.
I thought of her when you mentioned salt, because that's one of her primary things she talks about, especially the salt that you don't even know about really
Yes,
when
sir,
you eat
that's
so
correct.
many foods. Now
That's
let's turn to
correct.
some good news and a new effort that you have, and that is there is an app for everything, but you have developed and have begun using an app that can be of real help to people who suffer from hypertension. Tell us more about that.
Yeah, so about 2 years ago, my team received some funding from the Alabama Department of Public Health through the CDC. And our mission was to develop a mobile health app in partnership with the Center for Advanced Public Safety here on campus. We have developed an app in Android and smartphone versions. It's free. Anyone can download it and use it. It's called Hype, Hype, and we're very proud of it. We launched the first version 2 years ago. We just launched version 2.0. And with every version, I think we're getting it a little better and making it a little bit more user-friendly. We've adapted it based on patient feedback. But again, it's called Hype, and I'm very proud of it because patients can obtain information through the app. They can also keep a log of their medications, which is very important. And they get reminders if they don't take their medications, because let's face it, it's hard to remember to do everything every day. And they can also capture their weight, their blood pressure, their heart rate, and activity. So it's a nice place to have a repository of information, and we're hoping to spread the word a little bit more. We've focused a lot on development and kind of working out some of the glitches, but we really are encouraging our patients, all patients, anybody in the community can download it. But we're trying to focus and make hypertension a practice priority at University Medical Center.
It's simple to find. It is free, you said, and all you need are the 4 characters HYPE, and download the app.
Yes, sir. It looks like a red heart is the logo.
It is another tool you're using, and I'll make this my last question to you, another tool you're using in a battle that from the outside might look like one we'll never overcome, but every little effort you make, including this app, is another tool that people can use who want to live a long, long time.
Yes, and I think the thing that I'm most proud of is that it engages the patients to be involved with their care, and it encourages self-monitoring, because we now know self-monitoring our blood pressure at home is essential to blood pressure control.
And your involvement, taking personal responsibility for checking on yourself, sort of empowers any patient too, doesn't it?
That's exactly right.
Dr. Louanne Friend, thank you so much for joining us today, telling us about the app and reminding us that we all need to eat healthier, be careful, because all of us want to live a long, long time. Thank you for your time.
Thank you very much.